It's passed through what we call respiratory droplets. So if I sneeze or if I cough, and you're within 6 to 10 feet of me, you're at risk of catching the virus. The other way it happens is through direct contact. So for example, I touch my nose or my mouth, I have my secretions that are filled with virus, and then I shake your hand, and then you touch your nose and mouth. That's the other mechanism. The third is that if the virus is on a frequently touched doorknob and people come by there, that's another mechanism. So when we're thinking about the prevention of those, how do we stop those with social distancing? It's really distancing. The social distancing is decreasing the number of close contacts that we have with people. And those close contacts are usually people, being within 6 to 10 feet, usually around 10 to 20 minutes, so that, when people sneeze or cough, those kind of exposures, infections occur. Because the virus first colonizes your upper respiratory tract, your sinuses, your throat, your mouth, those areas first, and then it will spread to the lung. And so that's why hand washing is really an important prevention mechanism, so that we can not protect others from getting infected. And the other is also kind of what we call respiratory hygiene, covering your mouth with a Kleenex or a tissue, when you're coughing and sneezing, and throwing that away and then washing your hands. This is a concerning, epidemic. It's now called a pandemic by the WHO. We're concerned because it's transmissible. It's probably more transmissible than the typical seasonal flu that we have. The other thing that we're worried about is that the death rate. So among all the people who get sick, how many people die? We know that we're still getting more evidence about how that, what that exact number is, but it does seem higher than what we see for the seasonal flu. And that really kind of concerns us, because you can imagine how many Americans that will get infected, and among those, how many get sick. And of those, if a significant proportion, whether it's 1 to 2%, die from the disease, that's a major public health problem. It's quite common in the beginning of an epidemic, when you're identifying only the severe cases, that case fatality rate, or the proportion of people who die among all people symptomatic, is high. And as we learn more and get more information, we start identifying all the people who get sick, that number goes down. So right now it's been stated at 3%, but that's likely probably going to go down to 2 or 1% based on what we're learning about the disease. The good news is that this virus is not as deadly as, for example, SARS or Middle Eastern Respiratory Syndrome virus, which is MERS. The cousins of this virus, those case fatality rates or death rates were much higher. 10 to 15% of those patients died. So it's not as lethal as those viruses, but on the other hand, it's higher than what we commonly see with influenza. Those death rates are about 0.1%. So you can imagine this is an order of magnitude, or perhaps more than 10 times those death rates that we have each year with influenza. The good news is that children and young adults, they're actually have very few, so the risk of dying from this is very small. And actually the risk of being hospitalized or having severe pneumonia, having to go to the intensive care unit, is actually quite low in that age group. What we can particularly worry about are the elderly, the people over 60 years of age, 70 or 80 years of age, where the death rates are actually quite high on those, and they're the most vulnerable when we're thinking about this epidemic or impending epidemic in our communities. We don't know how it's going to transmit, when we get into the spring or the summer. We hope that it acts like flu or influenza or other respiratory viruses, where the infection dies off in the warmer months as we go into the spring. However, we don't know at this moment, and we're, this was a hope and aspiration, but that's why we have to do our work now to kind of control the epidemic. And so for what we do know about the disease is that people, before they get sick, can transmit the disease. The big question is how much of all the transmission that occurs in a community is due to that proportion of asymptomatic or people who don't have symptoms before they get sick and are able to transmit. That we don't really have a a good handle at that moment. But we do know it's important, it happens. The question is, how much does that fuel or drive the outbreak? And I think this is one of the things that all researchers and epidemiologists are trying to look for, is how important that is, because that will certainly influence whether we can get ahead of the curve or behind the curve. The evidence that's coming out, from the global pandemic, and particularly China, which was hit first, was that if you're sick, and particularly the critically ill people who are in the hospital, they actually can be infectious for up to 20 days after they're hospitalized or they're identified. With people with milder diseases, that's probably people having what maybe like the common cold or a fever, those and then they get better. They're probably infectious for a period of eight days, and that's what some recent literature or recent scientific studies have showed us. So the incubation period is like the time that the virus is incubating in your body after an exposure or an infection occurs. So it's a time period between when somebody is actually infected or through direct contact or respiratory droplets till the time they develop symptoms. And that period is actually very important, because it actually guides a lot of the public health actions that we do. One of the most important things, of course, is when somebody gets sick, to isolate them so they're not running around the community and spreading it to other people. But the other thing that's important is those contacts, the people who live in the same house or workplace, the people who have had close contacts with that person. We as part of public health prevention, we quarantine these people. And knowing how long we have to either quarantine those people, or the other option is to actively monitor them. We call them every day and see if they get sick. We now know that period that 14 days, falls in the period where we can capture almost everybody who's been exposed and infected, and will go on to have disease. The current CDC guidelines are, if somebody has been exposed, or somebody's living in a house or has had close contact with another person who's had a confirmed coronavirus infection, that they stay in isolation in the house. The public health officials will call them every day, and that period is 14 days. Now we know that period is actually, correct or actually appropriate given the scientific evidence. And that's important because you can imagine all the, especially in New York, where you have to have public health officials calling every day or checking up on people for quarantine or isolation. And that gives us an idea exactly when we can start and when we can stop those labor-intensive activity. So in the beginning, we were actually doing containment. So every single case, whether they came from a country such as China or Korea that was entering the country, we would try to identify those cases, track all the contacts, and try to contain them. Now that the virus has spread beyond that, and that we're having cases who don't have any travel history or don't have any known contacts that were infected, we're worried about what we call community transmission. And that's where mitigation comes in. And that's where we're trying to reduce the impact. Certainly one of the major goals is to protect the elderly, those people who are at highest risk of disease. The other part is flattening the curve. And this is what was done in many different settings in different countries. What they're trying to do in Korea with massive testing, where you really go out, you try to identify everybody in the community who's sick, isolate them so they're not around infecting other people, and having them stay at home, taking the contacts and having them stay at home as well, and checking up with active monitoring if they get sick, and then keeping them there. And that's what flattening the curve is. So it's really the effort to, which is important, is to push us out of that influenza, where all our hospitals are already filled up. We need to get ourselves out of the influenza phase, and we need to be in a place where we can receive our patients, take care of them, where our ICU beds are free, to care for people with the severe complications of pneumonia due to coronavirus. South Korea took a hit, they had a hit because they had this big super spreading event where infection occurred during this church group and then spilled over. And so they jumped on it very, very quickly. There are other countries in like Singapore or even other cities in China that really got out of the head of the curve after the big epidemic in Wuhan occurred. I think the cautionary tale is what's happening in Italy, and we're also worried about what's happening not only in Italy but in Spain and France, Germany, where those case numbers are going up exponentially. So we're getting back to your question: where do we sit? I would hope that we're more on the better side and more working in containing and flattening that curve. I think the biggest question here is that we need to do the hard work. We need to go out, we need to identify cases in the community, we need to isolate them, and we need to kind of do all the good public health practices as well as the social distancing. It's not an easy ride. It's going to be a long haul for us. So I hope that we're not going to turn out by Italy, and that requires immediate action right now, both at the local, state, and national level. I think there's a lot that individuals can do in terms of hand hygiene, respiratory hygiene, if you're sick, staying at home. There are things that businesses can do in terms of distancing people, social distancing within the workplace, or having people work, through remotely at their homes. And I think most importantly is really what the public health officials need to do. We need to protect our hospitals, because those are potential incubators. And this is go back to the tale of Italy. This is, the hospital healthcare worker outbreaks that are occurring in Italy are really quite devastating, and we need to protect our healthcare workers. We also need to really go out in the community and track down all those cases and identify them, test them, when they're confirmed, have them isolated, and do this in the least socially disruptive way. If we really want to flatten that curve, and I think more importantly, do things proactively before we're in the back, when you're doing these things at the top of the epidemic, those are much less effective than when you do that, when you get ahead of the curve and you do them now. So that's why now, for at least in Connecticut and also nationally, now is the time that we have to act and implement these interventions. So Italy unfortunately had widespread transmission before effective or prevention methods were implemented. And they also had, similar to us, they weren't prepared with respect to testing and rolling out mass testing. And that's the cautionary tale for us. We still have time, and that's why it's important that we do this now, and get out of the reasons why this happened, but really focus on what we need to do ahead. And you can see what's happening in Italy, and you can see what happened at Wuhan, in China, in the epicenter. Those were devastating. Not only was it devastating in terms of the people who were sick and people who died, but it's also devastating in terms of what it did to the social structure and how it disrupted that. I think the cautionary tale for us is Italy at the moment, and how we can prevent and make sure that we're not going that direction, because the costs are high. You can imagine a family where both parents are working and they have kids in school. If schools are closed, how the parents, what do they do in terms of taking care of the kids? You can imagine if you had an elderly person sick at home, and who's going to take care of the elderly when they get sick from coronavirus? So I think those are the kind of the issues that we have to think about, and those are a balance. We're talking about matters of days, not weeks or months, but these are really days that we really have to implement, not only in public health, but you can imagine the huge social disruption that's happening in Italy, with the lockdowns, closures of all businesses. Imagine, even for us to close school, who's going to take care of the kids? If the kids live with the elderly? Those are important issues that we need to really upfront deal with now. If you have a salaried person who makes a daily wage and doesn't have compensation for sick days off, how is that person going to pay the rent, get the food? What happens to people who are sick and who are isolated? Who's going to bring food to them? Those are the kind of issues that we really need to get our heads around right now. And we need to have done that several weeks ago or months ago, but we need to do this now. I think the important thing about the United States is that we have really a dedicated, public health staff, both at the local, the state and the national level with the CDC. These are people who have a lot of experience in dealing with outbreaks. We have a strong infrastructure. I think what it really will take is the key issues, which is everybody's mind: producing kits, getting people tested, having the hospitals react, implementing healthcare prevention, healthcare worker prevention. And I've been involved in a lot of different outbreaks, mostly in Brazil, in much poor settings, resource poor settings. And I think the major issue is that you can't, there's always time to look behind and understand, and those are important lessons learned. The big issue is to look forward, and what do we need to do today, tomorrow, and the next day? That's what we need to keep our focus on. There always will be time to go back and understand what happened. And those are going to